Every woman copes differently when presented with the news that she has breast cancer. Each woman also reacts differently when having to make decisions about treatment. And women cope differently with how they live their lives in the time after treatment. We are all different. Some women want to communicate with friends and family. Others want to be alone, to walk and think. Women may want different things at different times. They may run into difficulties, feelings of sadness, loss, fear, at different points along the way. Many deaf and hard-of-hearing women consider it impolite to ask about the experiences of other women, particularly those who may have had breast cancer or a breast abnormality. But I think you'd be surprised to know that breast cancer survivors often welcome the opportunity to talk about their experience, and maybe even more so with deaf and hard-of-hearing women. If you are seeking more information about screening or diagnosis, making treatment decisions, considering a clinical trial, or coping with the feelings and thoughts that can follow breast cancer treatment, talking with other deaf and hard-of-hearing women, especially deaf and hard-of-hearing breast cancer survivors, may be a good place to start. A local agency that serves the deaf and hard-of-hearing community can help you locate such women. You can ask your agency if they know of any existing support groups that you can attend. You might also ask the agency if they can assist you in setting up a support group for deaf and hard-of-hearing women, or a series of panel discussions with deaf breast cancer survivors. As a woman makes decisions on how to best move on after treatment, it is important to do the following things. Understand your follow-up care plan. And follow it carefully. Recognize that your quality of life may or may not be affected. But that difficulties are certainly normal. There may be physical or emotional issues, particularly once treatment ends. This is normal. There can also be sexual problems. You might experience fatigue or depression. You may have concerns about body image. You might worry about the impact the illness has had on the family. And about the possibility of recurrence. You may be worried about the financial costs of this disease. There are concerns about what will happen tomorrow. There are also concerns about what can happen further into the future. You should inform doctors about having had breast cancer. In preparation for meeting any doctors, keep a folder with copies of pathology reports from a biopsy or surgery, operative reports from surgery, and hospital discharge summaries. Keep all these reports together. And make sure you have these reports in hand when you are discharged from the hospital. Keep a list of all your cancer treatment drugs, the names of what is being taken, and the dosage. Make sure you have all of this on a list that you can give to your doctor. Remember to share this medical information with your future doctors who may not know about your breast cancer. Consider making healthy lifestyle changes. You might decide to stop smoking. You might decide to start eating a healthier diet. And you might consider limiting your alcohol use. Get the rest you need. Talk to the doctor about a healthy, safe exercise plan. Get the help and support needed to cope with this challenging time in your life. Don't try to do it alone. You can go ahead and form a support group with other deaf and hard of hearing breast cancer survivors. If there is no deaf support group available, or you can't set one up, you might find a support group of hearing breast cancer survivors that you can join with an interpreter. Share your experiences and your strength and your hope regarding recovery from breast cancer with your friends, your family, and with other deaf and hard of hearing women. Learn more about resources and the steps to take to ensure that every deaf and hard of hearing woman gets the information she needs and gets all her questions answered in Chapter 4, Getting Information, in this DVD.